I think we'll make a start now, folks.
Okay, right, thanks, Matthew. Good morning, everyone. My name is Simon Capewell, and it's my privilege and my pleasure to be chairing this session to celebrate HEG's 20th year, our celebration, 20 years as a charity. We're calling it Partnering for Prevention, and in the next 55 minutes, we're going to offer a few insights over the 2 decades, focusing on past, present and future. Next slide, please, Michael. So some obvious housekeeping rules. Thanks for joining us, and thanks to our distinguished panel members for contributing as well. To celebrate the 20-year anniversary, we're producing 2 new documents today. One on Health Equalities Group, reflecting on 20 years of preventative action, with a bit of detail on some of the greatest achievements, and there are many. And another brief document on Partnering for Prevention, summarising some of HEG's current projects and some of our advocacy work. So we'll distribute both of those documents and also the slides from this session after the event. We felt that 55 minutes was probably as much time as we should take from everybody's busy day. So we won't be fielding questions during the session, but we would very much welcome you writing into any of us to continue the discussion and to follow up on particular items of interest. Next slide, please. So over the next 55 minutes, we're going to have a little review of the past. I'll talk about the rationale. Robin Ireland will talk about the evolution from Heart of Mersey to Health Equalities Group. Then the team, Nicola Calder, Michael Viggers and Matthew Philpott, will each take a turn describing some of the current activities. We'll have a brief comments from our distinguished panel, and then the last 5 minutes will be looking to the future and how HEG can support your organisation. Next slide, please. So the rationale, really, it's all about making the case for population level approaches to preventing not just heart disease or stroke or common cancers, but diabetes, lung disease, kidney disease, in other words, non-communicable diseases or NCDs. Next slide, please. It all started with heart disease, and way back in the 70s in Finland, the North Karelia project got going, focusing on reducing population level risk factors. And so by the 1994 in the BMJ, they were able to publish this epic paper showing that heart disease and stroke deaths had plummeted over the previous decades, due very much to their policy and regional interventions. And when they actually did the sums, the reductions in smoking, in blood pressure, in cholesterol, explained the very large part of that reduction in deaths and disease. There was a gap, which was probably due to treatments. We looked at this in several other countries. Next slide, please, including Scotland and New Zealand and England and Wales. And between 81 and 2000, deaths fell by about a third, 68,000 fewer deaths that meant. And risk factor improvements played the major part, 70% of the total. And even in spite of things, adverse drifts from diabetes and obesity, minus 13%. So moving on. Over that time, the inspiration, next slide, please, Michael. The inspiration then from North Karelia was profound. Mersey Health Action Zone funded a study visit there, and this inspired us to obtain further funding and launch Heart of Mersey in 2002, with very much a focus on population-wide interventions, because we knew those were the big levers. We knew that face-to-face, doctors and nurses with individual patients made a contribution, but the big levers were regulation, taxation, and things that created a healthier environment. So this became Heart of Mersey became a charity in 2005, and this picture shows Robin and myself when we were slightly more youthful, with signatories from the World Health Organization. Next slide, please. So a lot to celebrate. Over the 2 decades, we've got to understand better and better that the drivers for not just heart disease and stroke, but also common cancers, all of the non-communicable diseases are increasingly clear. So 40% of the drivers comes from poor diet and obesity, 20% from smoking, 10% from alcohol, 5% from inactivity, pollution, that sort of thing. 40, 20, 10, 5. So it's become increasingly easy for us to focus, prioritize on poor diet and tobacco control because of that. And of course, next slide, please, Michael. It's important to remember that all of this is compounded by poverty and deprivation. So inequalities is a major issue. To continue the story, next slide, please. I'd like to turn to Robin now. Robin was chief executive for Heart of Mersey and then HEG through to 2016, and he continues as the Director of Research. So Robin, would you like to continue the story, please?
Yeah, certainly. Thanks, Simon. Just to say, next slide, please, as well, Michael, if that's all right. What an enormous pleasure it is to be here, actually. One doesn't often have the opportunity to discuss an organisation that they've been involved with more or less from the beginning, along with Simon. And it's wonderful to have the opportunity to reflect. I would say as well, it's always incredibly important to use those moments as well, because there's an awful lot to learn along the way, and sometimes all of us are guilty of not giving ourselves a chance to reflect and think back. So thank you for this opportunity today. So I'm going to go obviously swiftly due to time on all these areas here. And as Simon said, if we don't cover everything, please do come back to me afterwards. It's fabulous to continue the conversation. Next slide, please. Oh, thanks. The first point here is really, really important. Well, they're all important, but just to say, when one sets up organizations, there's enormous pressure sometimes, whether it's a program, whether it's a charity or whatever, but to get things moving. And you know what, if you don't get a governance and accountability right at the beginning, it's very, very difficult to go back. You need to be clear about what you're doing, why you're there, who you want to be involved with. It's very, very hard to backfill. And over the obviously it's more than 20 years that I've been involved with first Heart of Mersey and Health Equalities Group. I've seen other organisations go by the way, often not their fault whatsoever, but the environment that we found ourselves in. But getting that governance and accountability, being clear where you get your money from, that's incredibly important as well. And we all know the temptations when money is very tight to sometimes take money from the wrong places. It's really important to be very clear your governance, your accountability on your values. And let's be honest, we don't and never have had the money of industry, for example. We've not had central government funding. So we have to box very clever, and a lot of organisations, the voluntary sector, have to do that. We need to see where we get best value for our intervention. Next slide, please. And that's always been based upon evidence-based public health. Simon's talked about that. I'm not going to go through every single item on each slide due to time, but it's worth pointing out, and I had to be reminded of this, by 2009, Heart of Mersey was England's most comprehensive regional cardiovascular disease primary prevention programme. We started off in the days of primary care trust. We were hosted originally by South Sefton Primary Care Trust in Crosby or Waterloo in North Merseyside, and along the way we glossed along. We've had to move offices. We all know the pressures that organisations are under, and that was our beginning, and it was very much Liverpool, Merseyside, and we broadened from there, and that's what I'm going to go on to cover the next few slides before my modern day colleagues, if that's the right way of putting it, will talk about the action now going on. Next slide, please. I'm incredibly proud of all sorts of work that we've done along the time, and although we don't do very much around tobacco control these days, in our days it was really important. And I was just thinking very briefly of the timing back when we were doing tobacco control work, working across Cheshire and Merseyside. We did a lot of advocacy work. The Smoke-Free Workplaces Act, Indoor Smoking Act, came through in 2000. It was enacted in 2006. It was voted on in 2005. That was pre-iPhone. We were all working in very different ways. But the really important thing in my feeling in learning from those kind of times is you really can have influence from what's happening locally to what's happening nationally. For people that weren't aware about it, next slide please, in Liverpool and then across Merseyside there was this determination to actually, if it wasn't going to happen nationally, let's make it happen locally. And the work that was done both in Liverpool, in Merseyside, and across the Northwest had a huge impact of what's happening nationally in terms of that legislation that was passed. We were creative, we were innovative, we didn't take no for an answer. I've talked there about local for national. At the same time, we were remembering our local areas, and we developed smoke-free play areas way back when. If you go to loads of play areas on Merseyside now, you still find these placards that must have been up for years, and I'm very proud of that work at all different levels. Next slide, please. Food Active as an organisation actually predates from 2013. Nicola will be going on to talk about that later, but again, just to get a context, this is Kat, if you don't mind me saying, even before Obesity Health Alliance was formed, we already realised back in 2013 that sometimes it wasn't worth waiting for government to do things. We wanted government to do things, as Simon has correctly said, the big changes always happen at national level. But what we do locally has an impact upon that, and there are things that are really important that we can do at local level, which we really need to focus on at the same time. Way back in 2014, so 11 years ago, Directors of Public Health published their own top 10 for number 10 public health manifesto, and within them were a lot of things that both ended up later on in our healthy weight declaration, which Nicola will talk about, but again also had impact in terms of national policy, in terms of a levy on sugary drinks that was introduced much later. Next slide, please. And we talked about being evidence-based all the way through. We were very clear right from the beginning that sugar was a big problem in our diets. It contributed to prevalence of overweight and obesity. It was linked with health inequalities, not just levels of overweight and obesity, but also our oral health. We launched quite a powerful campaign back in 2013, 2014, Give Up Loving Pop, which we're still involved with now. And can I say, when we launched that, we had a lot of pressure against what we were doing at all different levels. It wasn't easy. And I like to think that along our history, we show that we've been innovative, creative, and we've been able to stand up for ourselves, as it were. We've gone with a pushback, and you'll know that even now we are still battling the manifestation of commercial determinants of health with the very visible Coca-Cola truck and other commercial determinants of health that you can address and tackle both locally, regionally, and nationally. Next slide, please. I haven't got too much longer, and again, leading on to work we're doing now, we realised that in Merseyside, culture was very much sport. We thought, why is sport always associated, with, as in the picture there, it's often unhealthy food. We don't consider it as a setting, and we developed, again, working with colleagues, a definition of what a healthy stadium should be, one which promotes health visitors, fans, players, employees, and the surrounding community. Next slide, please. Again, it's fairly remarkable looking back at the time we were doing this. These are the days of when we played a very proud part in Europe, and we, working with the Northwest Health Brussels office, were successful based upon the work that we've been doing across Merseyside to bring in close to €750,000 euros to develop a project and to take the work we were doing with Healthy Stadia onto an international stage, and during that period working with UEFA. Next slide, please. So obviously all of those areas I could talk about in detail. I'm delighted my colleagues are taking this work forward today. But if I conclude even briefly, you can see there the strength and value of what I hope we've achieved, and indeed what the third sector as a whole has been able to contribute to public health. The importance, we've been around since 2003, how important it is to shape the message according to the social, cultural, economic context we find ourselves. It sometimes is around patience and persistence. And as I said when I started, I'm incredibly pleased to be here 20 years after becoming a charity. I'm still persistent. I know the organisation is. So thank you. Let's hear about the other work that the Health Equalities Group is doing now. Thanks for your time.
Thanks very much, Robin. So summarising 20 years of achievements in 10 minutes is quite an achievement itself. As discussed, there's a lot more detail in the document that we're going to put out today if people would like to see just how the organisation has evolved. It's my pleasure now to introduce consecutively the three members of the team leading on current activities. Nicola Calder, Michael Viggers and Matthew Philpott. And Nicola's going to kick off by talking about addressing the food systems agenda. Nicola, thank you.
Many thanks, Simon. And if we could move to the next slide, please, Michael. As Robin's already referenced, the Food Active programme was established back in 2013, and 12 years on, we're currently commissioned by 21 of the 24 local authorities across the North West. We have three core objectives which underpin our programme delivery, and these are developed annually in consultation with our commissioners. We advocate strongly for policy to support healthier weight at a regional and national level, providing a collective voice for public health in the North West. And just to offer some examples of our advocacy work, such as responding to relevant consultations, last year a formal response was submitted to the House of Lords inquiry into food, diet and obesity, and Food Active also supported a visit on behalf of the committee in collaboration with Blackpool colleagues to demonstrate some of the work that was happening across the local authority area. More recently, we've had the opportunity to meet with Ashley Dalton MP, Under Secretary of State for Public Health and Prevention at her constituency office in West Lancashire, to discuss our policy calls and work that's currently being commissioned across Lancashire to create healthier places. Thank you, Michael. We have a further objective around helping to build capacity locally and support public health teams by developing campaigns, toolkits and training resources to create healthier places and settings, with a particular focus, for example, on school environments, by promoting healthier vending in hospitals and leisure provision, or ensuring that holiday and activity food providers meet the required school food standards. And we have a third objective, to build strategic partnerships and further develop the evidence base that support our policy calls, while strengthening lobbying efforts and building partnerships with national stakeholders, with a particular focus on addressing the commercial determinants of health. And I know Kat's going to come on to talk about some of that collaboration, particularly in terms of our advocacy work later this morning. Thanks, Michael. Food Active's Local Authority Declaration is an example of a local policy tool aimed to support councils take a place-based systems approach to promoting healthy weight. This was first launched back in 2015 in consultation with a wide range of stakeholders from across the North West, working closely with our public health colleagues and directors of public health. It's since been adopted by over 35 councils nationally, from county, unitary to district authorities. and it's recognised as a key framework to support promotion of healthier weight. It's underpinned by 16 commitments that are made and adopted across all council departments, and it provides an opportunity for councils to take a strategic commitment to promoting healthy weight, whilst recognising the importance of system leadership in utilising local policy levers to create healthier places. Thank you. Next slide. So over recent years, we have also developed additional frameworks to support partners across the system through development of the NHS Healthy Weight Declaration, our schools pledge, and also our partner pledge. We've also developed a wide range of support materials to support stakeholders in adopting these frameworks, many of which are available through the Healthy Weight Declaration Resource Hub, and include wider support for implementation and adoption of the declaration, communication support, launch guides, annual learning events, and also in terms of sharing best practice and demonstrating the impact of the declaration in terms of promoting healthy weight across local places. Next slide, please. As a network, we also aim to promote best practice and share learning through events and communications, such as the annual Food Active Conference. This is held every winter, and the next event will be taking place on the 11th of November. This will take place online, and registrations will be launched later this week, so please do look out for that. We also host face-to-face and virtual webinars as a way of supporting learning and development across the network, whilst hosting annual events to support specific policy approaches, such as the Healthy Weight Declaration annual learning event. And we also have a range of mechanisms to communicate with that broader range of stakeholders across the Northwest, but beyond, in terms of delivery of specific projects and programmes in other regions. Next slide, please. Finally, just to share some information regarding the Why Wait to Talk programme. This was originally commissioned by Cheshire West and Chester Council back in 2022 as part of their whole systems approach to healthy weight. We know in terms of the evidence base that effective population level health systems consider the wider determinants of health while supporting healthy behaviours. But we also recognise that frontline staff are in a privileged position to talk to children and young people and families about healthy weight. And evidence also suggests that well-planned, very brief interventions can increase the chances of a person attempting weight loss and accessing support. So in terms of the core objectives of this training, this is very much around enabling and empowering professionals across the borough to deliver brief advice on healthier weight, whilst increasing knowledge on the wider determinants of health. And through consultation and the development of this training offer, whilst we became aware that practitioners need to feel confident and empowered to raise the topic and have conversations around healthy weight, they also need to feel confident in terms of onward referral. So in terms of what makes this particular training programme is unique, is that opportunity to work with local authority partners to provide a detailed overview of the services available locally for weight management. Next slide, please. So we've since delivered 2 cohorts of the training in Cheshire West and Chester, before scaling delivery of the programme up throughout the Cheshire and Merseyside ICB. So this particular delivery was commissioned by NHS Cheshire and Merseyside Children and Young People's Transformation Programme. We worked with 8 of the local authorities in terms of delivering this particular approach to deliver a total of 52 training sessions, which were delivered both in person and online. We work very closely with colleagues at Halton Health Improvement Team in terms of that partnership approach to deliver the training. And just in terms of the breadth of the staff, the types of staff groups that we reached, you can see some of that demonstrated there on screen in terms of the 0 to 19 service, working with teachers and educational staff, staff through primary care and the voluntary and community sector, and obviously importantly our local authority public health colleagues. Thanks, Michael. So just finally, in terms of an evaluation of the programme, which was delivered to over 600 practitioners across Cheshire and Merseyside, we were able to complete pre and post questionnaires with participants of the training. And what we were able to demonstrate was an increase in confidence to engage families and an increase in confidence to refer. And this was observed not only post-survey completion, but also at 3-month follow-up. So just to finalise, and we're now working with several local authority and NHS commissioners to shape various projects using this approach. Many of these addressing weight stigma and reinvigorating MEC approaches whilst mapping current service provision. And Why Wait to Talk is bringing together partners across systems to address healthier weight at place. So I'm just going to hand over to Michael now to take us through our public health work across sports stadia. Thank you.
Thanks very much, Nicola. Hi everyone, I'm Michael. I'm going to be giving you a whistle-stop tour of our Healthy Stadia programme from over the last 13 years. So just to start with and to build on the picture that Robin began to paint, Healthy Stadia is actually a social enterprise within Health Equalities Group, which was formed back in 2012, working across the fields of professional and amateur sport, stadium operations and public health. So quite a unique niche that we found in terms of addressing public health outcomes. The main aim of the programme is to support sports organisations to develop healthier stadium environments, very much taking a settings-based approach. Some of this work includes stadium-based policies, such as designing and implementing tobacco-free stadia policies, supporting stadia to promote and facilitate active travel, and developing healthier matchday menus. In addition to community and fan health, so identifying how sport can be used as a vehicle to work with at-risk groups, such as men in underserved communities, and also a fair amount of work, again, as Robin mentioned, around tackling the commercial determinants of health and trying to address sponsorship arrangements with sports organisations and unhealthy commodity industries. So just to give a little bit more information around our work on tobacco-free stadia, we know in the UK we have comprehensive legislation that prevents fans from smoking in stadia, but amongst many European countries, the legislation isn't comprehensive in that way. So we've developed guidance that helps sports stadia and their operations teams to implement effective no smoking policies that prevent and police fans in stadium from smoking tobacco, and indeed more recently vaping as well. So we have a step-by-step framework within the guidance pictured on screen that helps clubs and stadium operations teams to implement these policies, covering everything from the policy itself, communicating with stakeholders, training, and crucially, enforcement. The guide is available in over 5 different European languages and is being used across the continent to help implement these types of policies to protect fans from secondhand smoke and denormalise smoking tobacco whilst watching sport. In addition to work on tobacco, we've also undertaken a fair amount of work promoting active travel to sports stadia. If we can encourage fans to walk or cycle as at least part of their journey to a sports stadium, that might mean fewer cars, which means less congestion, cleaner air, lower emissions, and indeed safer journeys for fans. Even small shifts to active travel can deliver big health, environmental and traffic management benefits, whilst also strengthening clubs' community impact and their relationship with their local communities. Again, we have developed bespoke guidance to support stadium operations teams to consider how to do this. And the guidance covers, again, topics such as stakeholder engagement, integration with public transport, facilities, promotion, and indeed monitoring evaluation as well. In terms of some further key milestones from the Healthy Stadia programme, we work with UEFA, the European governing body of sport for football, to develop and implement a no smoking policy that was implemented at UEFA Euro 2016 across the 10 host stadia in France. In 2017, we supported UEFA again on the Women's Euro, developing a mobile app to track walking and cycling to stadia, helping to incentivise fans to consider this through tickets and other UEFA merchandise. In 2018, we held a side event at Windsor Park in Belfast, discussing the role of sports stadia in improving public health outcomes. This was a side event connected to the WHO Healthy Cities Conference. We also supported FIFA in their development of their own no smoking policy, and we've also supported the world's largest cardiovascular disease prevention campaign, World Heart Day, leveraging support from UEFA's 52 member associations. In terms of some other work focusing more around immunity and fan health, we were part of a very large research trial between 2015 and 2019 called European Fans in Training. This is one of Europe's largest lifestyle randomized controlled trials for men, delivered through 15 professional football clubs across 4 countries, reaching over 1,100 inactive men living with overweight or obesity. The programme itself involved 12 weekly stadium-based group sessions, again leveraging the power of the sports stadium to bring fans to the stadium to engage in their health. In terms of the impact of this programme, at 12 months, we were able to demonstrate that participants showed an increase in physical activity, weight loss, improved diet, and enhanced well-being, demonstrating again the power of football clubs as trusted settings to engage underserved men. And it's not just men that we work with, although that is a significant target group through the Healthy Stadia programme. We also work with children and young people. And as Robin mentioned, our Give Up Loving Pop programme, while starting out as an advocacy campaign, ultimately has evolved into a behaviour change programme delivered in primary schools at Key Stage 2 level. The programme includes a range of assemblies, PSHE lessons aligned to the curriculum, and a 21-day challenge to improve children's knowledge of the content of drinks, promote oral health, and reframe water as the best choice for hydration. The programme's delivered at Year 3 and Year 4 level, and schools are prioritised based on deprivation data and other local public health intelligence. Crucially, and to bring in that sports angle, we work with professional sports clubs and their community foundations to deliver the programme, training sports coaches to go into the schools and deliver the programme. The programme is typically commissioned by local authority public health teams and increasingly NHS organisations to address poor oral health. Just in terms of some future directions for the programme, as mentioned, we continue to advocate for changes in sponsorship policies to address the presence of unhealthy commodity industries such as gambling, alcohol and food within sports context. We ran a campaign a couple of years ago trying to address gambling sponsorship in Greater Manchester, gaining support from the Mayor and a number of professional football clubs. And we're also delivering currently some bystander intervention training across Cheshire and Merseyside to address violence against women and girls. Ultimately, whilst the programme is 13 years old, we've tried to evolve and move with the times, and we'll continue to do so in the coming years. I'll now pass over to Matthew, who will build on our work around settings-based health promotion.
Thanks very much, Michael, and good morning, everybody. I'm just going to give you a couple of examples of current work that we're delivering through our own ICB in Cheshire and Merseyside. Next slide, please, Michael. So the first example I'm going to give is the NHS Prevention Pledge. This is one of our flagship programmes, which is commissioned by NHS Cheshire and Merseyside. It's a work stream within the ICB's Population Health Programme, and we've helped co-design and deliver this over the last 5 years with provider trusts and more recently with primary care organisations within our sub-region. The original aim was to support adoption of a prevention framework by our provider trusts, which is effectively trying to embed prevention of ill health within governance, within service delivery, but also in terms of those environments, the trust estates themselves. Very glad to say that we have now engaged all of our 16 provider trusts in Cheshire and Merseyside who are fully engaged in adoption. So what does this mean? It's effectively a framework of 14 core commitments, and they take on cross-cutting themes addressing prevention, but also health inequalities, social value as well. So to give you a flavour of that without having to run through all 14 of them, it's around actions and policies that are reducing NCD risk factors, so around healthier catering, certainly around smoke-free sites and treating tobacco dependency. Quite a strong emphasis on workforce as well, both in terms of workforce development, so we can think of that in terms of embedding MEC training across the workforce, plus also a strong emphasis on workforce health and well-being. We're very much trying to increase social value, or the social value that can be produced and delivered at local level, and working towards anchor institution practices. There's a strong commitment around addressing health inequalities within local populations, and also promotion of positive mental health and well-being, not only for patients, but also for staff and local populations. Next, please. So what is this kind of delivering on? What's the rationale for this piece of work? It's helping to meet the prevention ambitions originally set out in the NHS's long-term plan, and very much delivering on that kind of front and centre emphasis on prevention within the new 10-year health plan. It's helping trusts develop as local anchor institutions. A lot of work in Cheshire and Merseyside to develop not only our NHS organisations, but wider longer term statutory organisations as anchor institutions. It's supporting the core 20+5 programmes, both for adults and for children and young people. And it's also helping support the objectives and delivery of some of our other population health programmes within the sub-regions, such as our Altogether Active Physical Activity programme, the Cheshire and Merseyside Improvement Framework, and our Altogether Fairer programme on health inequalities. But at its core, the bottom line is that the Prevention Pledge is driving a cultural shift towards embedding prevention in business as usual. It's not an add-on or a nice to do, it's prevention as front and centre. Thank you, Michael. So in terms of how this works, trusts are required to adopt a minimum of 6 or 7 of those core commitments within the first 12 months, and then start to work towards all 14 of those by the second year. It needs a board level commitment and identification of an executive sponsor, quite often a clinical champion, but also directors of transformation, quite often feature prominently as an executive sponsor. Trusts are required to evidence impact through an action tracker. So they need to show what actions and policies they have in place that are aligned to all those 14 commitments. And we look to have KPIs which are tied to those as well. And trusts are supported through a quarterly community of practice meeting, bringing our trusts together to share current practice. And we also have a suite of guidance materials to help as well. Thank you. So in terms of the last 18 months and recent developments, a lot more work from our trusts working towards commitment 3, which is our Marmot Principles commitment in terms of addressing health inequalities. Many trusts have now developed comprehensive health inequalities strategies, prioritising equitable access to healthcare and action on health inequalities with local partners at place. We've had a renewed focus on mental health and well-being with a relaunch of our Commitment 13. We had a working group that reworded that and tied it into national policy as well. And I'm pleased to say that in the last 18 months, we have run a successful pilot for primary care organisations that's been delivered in Cheshire and Merseyside, which is underpinned by a much more condensed version of the framework. Just 6 core commitments make up our framework for primary care. And the early adopters cohort has now grown to 12 PCNs in Cheshire and Merseyside. And in fact, just last week, we had our first community of practice meeting for our enlarged cohort. And that is something which we're looking to grow over the next few years. Next slide, please. So if you want to find out a little bit more about the Prevention Pledge, we have a website that you can look at, preventionpledge.org.uk, has information on the core commitments and a lot of case studies in there. So take time to look at that and we'll mail that out afterwards. The second example I just want to touch on very briefly is one of our newer programs. It's the Schools Pledge for a Healthy and Active Future, which is an evidence-based framework promoting healthier weight and well-being in schools. Again, this is funded by NHS Cheshire and Merseyside. It's now rolling out to 72 schools within our sub-region with a focus on schools from the 20% most deprived areas across our 9 local authority areas. It's underpinned by 9 core commitments, and this framework's been co-developed with public health teams and schools within our sub-region. And this aligns with the ICB's population health priorities, plus our local authority healthy weight declaration that Nicola touched on, and some national school food policies as well. In terms of those non-core commitments, I'm not going to go through all of those now, but the main themes that make up this core framework, it's very much around leadership, so taking a whole school approach in terms of engaging staff, pupils, governors, families and local communities. A strong emphasis on food and drink provision, so that's around nutritious meals, healthier choices, access to water and support on food insecurity for families. A strong emphasis on physical activity and active travel, so getting 30 active minutes on a daily basis, school mile, extracurricular activities and walking or cycling or scooting to schools. and overall well-being, so supporting mental and physical health, such as positive body image and an inclusive school culture. So very quickly, just a few highlights from some of our schools in Cheshire and Merseyside. In Cheshire West, there's been assemblies to launch their school adoption, including a pledge tree to set out their action plan over the next 6 months. A lot of work in Halton around themed sports days, incorporating the Daily Mile, healthy breakfast clubs. In Liverpool, we've had our first SEND school that has joined the programme. They had a launch event as part of their Arts Festival week. And in Warrington, they've appointed health ambassadors, and they've had some visits from the Warrington Wolves Foundation, but awful lot of work going on within the sub-region across all our local authority areas. That's just a quick couple of examples. And anyway, I'm going to turn back to Simon now, who's going to introduce our panel session. So many thanks for listening.
Thanks very much, Matthew and Michael and Nicola. So a lovely brief overview of just some of the many things that HEG is currently supporting and the actions that are being pursued. So do we have a microphone for Dave Sweeney? We're going to have some brief comments from the panel now. And my apologies that we don't have a lot of time. So Dave, are you there?
Yes, can you hear me?
That's great. So Dave is the Associate Director of Partnerships and Sustainability at NHS Cheshire and Merseyside. So thanks for joining our panel. The 10-year health plan, it's got a firm focus on prevention and working in partnerships across the system. You've been working with HEG on and off over the last 6 years. Does your experience of working with HEG highlight anything around the importance of working with voluntary sector partners to bring about change within the system?
I'll be really brief, and I do like the picture. I must use that more often. That's very catfishy and flattering. So please use that more often. Very simply, what I've just been sat and listening to the examples there. You're just doers. You just get on and do, and there's a massive difference in terms of talking about stuff and getting on with stuff. And my experience is very clear, is that yourselves and the voluntary sector just get on with stuff, and it makes a marked difference, and you see the outcomes. And my relationship predominantly with Matthew from your organisation is there is always a link. There is always a link. First point of call, if anything new comes in, be that Get Britain Working, a new government policy, health and housing, again, a new kind of government push. First point of call is Matthew. Who you linked in with? What are you doing? How can we kind of maximise this opportunity? And the answer is always yes, there is. And how can we push that forward? So just Matthew sits on our anchor assembly. So as anchor organisations now, we've got 41 organisations in Cheshire Merseyside now. Collecting that data from those anchor organisations has prompted a social value return of over £1 billion now, just from 41 organisations. Linking in the Marmot principles, linking in the work and health and housing, all those key policy drivers that we can go back and and not only supplement what the government is trying to tell us, but also kind of demonstrate that impact in our local communities. I also, as part of when they put sustainability is quite clear, because that's me. Economy and the economists are growing throughout the government. They're growing through policy. What you're going to see over the next couple of years is a real opportunity to demonstrate that economic return. And the voluntary sector, I never know how to put this, but you do things efficiently. You do things far more efficiently. So there's going to be a massive emphasis on that economy going forward. And you're seeing groups pop up here, there, and everywhere now with the prime kind of target of that economic view. So Matthew sits on our Anchor Assembly, and those organisations have just blown us out of the water. And all it is just celebrating what people do and turning it into a kind of a strategic theme. So you're already doing it. I mean, I'm going to finish up because there's other brilliant people to speak, and I know you're short of time. More of it, please. Keep smiling. It's, you know, I don't buy into this doom and gloom. It's, you know, we're in a really privileged position to be sat in jobs and sat well and healthy, and we've got large populations who don't. So I thoroughly support and proud to be part of what you do.
Thanks a million, Dave, and for being brief. So turning now to Kat. Kat, is your microphone on? Kat Jenner is our very distinguished pioneer in health promotion and public health, currently the director of Obesity Health Alliance. Thanks for joining our event, Kat, and for your ongoing partnership work with HEG, the national, regional, local links that have been emphasised. Long-standing member of HEG is a long-standing member of the Obesity Health Alliance, and some of our food active teams sit on the OHA policy group. Could you briefly maybe tell us a bit more about any collaborative work highlighting the benefits of having HEG as a regional voice from the northwest of England as part of OHA's advocacy work, please?
I'll be delighted to. You can hear me okay?
Yes.
Great. Yeah, thanks so much for having me here. It's a real pleasure. And Dave is absolutely right. You're doers, and at the OHA, we love yes people. The Health and Equalities Group, I'm not calling it HEG, has been such a valued member of the OHA for many years now, and we really benefit from your expertise and your reach. Having that strong local and regional voice in the Alliance helps make sure that our national advocacy is really grounded in real world experience and priorities. Food Active, as Nicola mentioned earlier, has given us really clear insights into how things like national policies, like the restrictions on junk food advertising at the checkouts. We've got the multi-buys coming in October the 1st, by the way, and energy drinks has actually played out locally. You've been really brilliant at mobilising local authorities, public health teams, academics, accessing real life case studies, which really add to inquiries and consultations to call for stronger regulation as well. And I sort of see it as a bit of a local to national pincer pressure that really strengthens our case in Westminster and makes it much harder for governments to ignore as well. We've also seen impact through things like our joint Directors of Public Health of the North Roundtable, things that probably people may not be particularly aware of that happen a bit more behind the scenes, and through your work with trading standards as well. Both really great examples of how that regional leadership can shape the national debate. And it's really powerful for us to show that these issues aren't just London bubble issues. The challenges of diet-related disease, health inequalities, and the broken food environment, as Dave said, they're around everybody. They're real across every region, and your work really helps bring those realities to life. So in short, HEG adds depth, credibility, reach to OHA's advocacy, and we hugely value that partnership. So because we haven't got very much time, I'm just going to say thank you so much. Get in touch if you'd like to hear more about our work, or in fact, if you're up at Labour conference, give me a shout. We'll be up in Liverpool on Sunday. And yeah, look forward to hearing the rest of the panel. Thanks, Simon.
Thanks very much, Kat. Always a pleasure. I think we've lost Beth Wolfenden. Beth, if you're there, please jump in. Otherwise,
Beth's not being able
right.
To
so,
to
Robin, very briefly, would you like to expand a little, please? You've been involved for over 20 years now. You've seen the growing support for population approaches to prevent NCDs. Looking ahead, what are some of the opportunities for voluntary sector organisations like HEG to further support statutory partners, do you think?
Thanks, Simon. I think I'm really going to echo what Dave and Kat said from different perspectives. I mean, Dave said, keep smiling, be positive, we're in a privileged position. I'm just going to reinforce that. We've been around as an organisation since 2002, 2003. There have been a lot of changes in that time. I talked about the iPad coming on, the iPhone coming on in 2007. An awful lot has changed. These are very, very difficult times. But we've been through very difficult times before, and the value of the voluntary sector is the adaptability, flexibility that we keep on going. And I'm just going back, you started off talking about Finland, and Like you, I'm being privileged to meet Pekka Puska and go over to Finland. And Pekka always used to say, if you're working in public health, you push, push, push. You keep on going, folks. And the important lessons that we've learned locally and regionally and how they contribute to what Kat's talking about in terms of national agenda, we can achieve change. We can achieve better health for our local communities and for our population. So yes, it's difficult, but I think the opportunities will be there for exactly the reasons that my colleagues have said. So thanks again, Simon, for enabling me to contribute to this.
Thanks, Robin. That's probably a good anthem for all of us in public health. Keep pushing, keep pushing. Michael, could you push the button and take us on to the next slide, please? So, Matthew, I think this is over to you. Would you like to just summarize how HEG can support everybody's organisation who's dialed in today?
Will do. Thanks, Simon. So just very quickly, I think I just wanted to kind of just touch on them. It's hopefully likely that you'll have picked up on some of this through the presentations earlier, but in terms of expertise and experience, yes, we have over 20 years now of experience of designing, delivering and evaluating public health programs with this strong focus on prevention of ill health. And in terms of our expertise across the team, we have multiple public health nutritionists within our team. We have experts on tobacco control, in sports science and physical activity. We have a couple of academic researchers, and I would suggest that perhaps one of our key areas of expertise is around taking whole systems approaches to tackling non-communicable diseases. We're absolutely grounded in collaboration with our partner organisations, and hopefully this is something that you heard from Dave and from Kat in that panel discussion. It's all about collaboration for us, whether that's with our local authority public health teams, primary or secondary care organisations, a lot of work with our charitable sector colleagues, but also a long track record of working with academic researchers and indeed a couple of examples of working with central government departments as well. Next slide, please. So in follow-up to today's webinar, we're going to be distributing a new portfolio document, which is called Partnering for Prevention. And essentially, this is going to give you examples of some of the way in which we work, and that is rooted in practical action and collaborative system change, whether that's around prevention frameworks that support this left shift in population health, perhaps something that we touched on in terms of the schools pledge, design and delivery of interventions addressing health inequalities, again, something that we've seen in terms of the prevention pledge that I presented, supporting applied research to inform policy and practice, and you could see that in terms of the Eurofit programme that Michael mentioned, workforce training and development and organisational capacity building, and we saw that in terms of our Why Wait for Talk programme that Nicola touched on, and also partnerships and in particular advocacy for system change, and that's something which is exemplified by our Food Active programme. Final slide, please, Michael. So from my side, it's a huge thanks to our commissioners, our grant funders and partner organisations. And I'd like to give a special mention to our fantastic group of trustees, both past and present, and our non-executive directors, all of whom have provided their time and expertise on a voluntary basis to the organisation for well over 20 years now. And I'd suggest that strong governance and guidance has been absolutely key to our success, and a special mention to Simon, actually, to Simon Capewell, who is our current chair within Health and Equalities Group and also has led us on today's webinar. A quick mention to our brilliant current team members and our past members of staff who've allowed the charity to flourish and make a real difference to our local populations. And of course, a big thanks to all of today's speakers and delegates for joining us for our 20th celebration. We will be distributing the slides, our new documents, our historical document charting the last 20 years, and our new portfolio document, and a recording of today's webinar. I know that there's been a few people who've had technical problems joining us, and I'm really sorry about that, but we will be able to send this recording. Anyway, that's it from me and from us, and a final slide and goodbye from Simon, but many thanks to everyone for joining today.
Matthew, team members, panel, ladies and gentlemen, thank you so much for participating. We've briefly described HEG's origins and some of the early successes. We've summarised current activities. We've emphasised the diverse skills of the team and also emphasised our ability to act as an independent advocacy voice for preventive public health when some of our partners, statutory agencies, would like to say things but need us to stand up and say them publicly. So thank you everyone, and have a good day.
Thanks everyone.